Overwhelmed hospitals, people dying on the streets from lack of oxygen, and packed crematoriums. This is a snapshot of the COVID-19 crisis in India. In contrast, just a few months ago, the Prime Minister declared victory against the pandemic.
उस देश ने कोरोना पर प्रभावी नियंत्रण करके पूरी दुनिया को, मानवता को बड़ी त्रासदी से भी बचाया है.
After that, there were political rallies, mass gatherings, and religious festivals, like this one. And then on April 21st, the country reported a record number of COVID-19 cases in a single day. And those numbers kept growing for several weeks, with many health experts saying real numbers are likely much higher. By May 7th, deaths soared past 4,000. As COVID cases in several Western countries have trended lower, the scale of infection in India and a new variant first reported there have alarmed the rest of the world.
If you have a huge country like India that's deep in its own COVID crisis, right? That means the pandemic is not going to end for the world.
Here's how India became the world's COVID hotspot and what that means for the global pandemic. First, we have to go back to early 2020. As much of the world was struggling to contain the virus, India appeared to have things under relative control.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
Early on, Modi announced the world's largest lockdown in the country of 1.3 billion people.
He publicly came out multiple times and said, we have to pull together, we have to wear masks, we have to socially distance. There was a lot of respect for COVID restrictions, and people were also scared.
The measures triggered a mass migration of workers trying to get back home from cities. Epidemiologists warned that this movement of people could help spread the virus undetected to other parts of the country. But the number of reported COVID-19 cases remained relatively low, and India's apparent success stood in contrast to some other countries, including the US, which was reporting more cases than any other nation. Some public health experts said a possible reason for few cases in India could have been the lack of widespread testing. But they also noted that the majority of the population is under 25, and since asymptomatic cases are more common among young people, many may have gone undetected. After a 10-week lockdown, India started to ease restrictions and the number of cases started growing, with the first peak in September.
It was quite bad, and the healthcare system was stressed, but the hospitals didn't, crumble or buckle. And we saw that actually in other parts of the world, it was much worse.
Despite that first surge, by December, India's numbers had gone back down, and by early 2021, life looked like it was returning to normal.
Stores were back open, they were super packed, restaurants were open, filled with people indoor dining, there were cricket matches again, packed stadiums. Life in Delhi felt like another universe. The US was dealing with another wave, right, in December, January.
India was doing very well compared to the US or the UK. And that's when Modi touted the country's success in front of other global leaders at the World Economic Forum.
जो अपने ज़्यादा से ज़्यादा नागरिकों का जीवन बचाने में सफल रहा है.
So what went wrong? Public health experts blame India's ferocious surge on a combination of new factors. The first one, people became more relaxed about COVID safety measures. Many people stopped wearing masks, and there were several crowded gatherings, which public health experts say may have been super spreader events, including huge political rallies.
मैंने ऐसी सभा पहली बार देखी है जी.
April was a key election month, and political parties, including Modi's BJP party, organized events across the West Bengal state. A BJP spokesperson said that no one had anticipated the magnitude of the COVID-19 surge, adding that Modi and other members of his party followed all the safety protocols in place at the time. Right around then, resources to fight the pandemic weren't reinforced or maintained.
Everyone essentially thought that COVID was over. By January, hospitals were taking down their COVID-19 wards. Testing centers that had been started last year were also being dismantled. Some of the oxygen plants where they had allocated the budget were never built.
And on top of all of this, highly contagious variants that were first identified in the UK and South Africa were circulating in the country, as well as a new variant known as B1617 that originated in India.
The 617 in India, it's a wily opponent.
The WHO has said preliminary studies indicate that this one may be more contagious than some other variants and has since been detected in more than 40 countries, including the US, UK, and France. This has added urgency to the global vaccination race, which has so far helped cases plummet in some of those countries. So, even as the COVID situation has improved in some parts of the West, the fight against the pandemic across the globe is far from over.
A big lesson is just countries can't get complacent. And even if one country is doing well, if another country is not doing well in terms of COVID, that will affect every other country in the world too.